Hi, everybody. Welcome back into Bite Time. Harry McCullough here. We spent a couple of topics, a couple of segments here on a very important topic, and we talk about Medicaid as things are about to change. And everybody that knows the state of Louisiana, we have a high percentage of patients that are on Medicaid, and things will be doing a redetermination on April 1st. March 31st, you have to declare it. April 1st is when everything's going to happen. That's when we're getting out of the emergency thing from COVID, and things are changing from that perspective. So real important to talk about it. Dr. Eric Brooks, of course, with the Office of Public Health, Region 3, the Regional Medical Director is here, and Taffy Morrison. She is a statewide community outreach manager for the Navigators for a Healthy Louisiana. So guys, thanks so much for being in here. This is a real important deal, right? And can you first describe how we got here and what is changing and why people that are on Medicaid need to know what's happening?
You want to take that one, Taffy?
Sure, I will. Let me tell you a little bit about maybe what we do and how it's linked into what's about to change. And so we are Navigators for Healthy Louisiana, so we are a federally funded grant through the U.S. Department of Health and Human Services, the Center for Medicaid and Medicare Services, through the Affordable Care Act. And our grant provides statewide assistance for those who need access to health insurance options, such as Medicaid, CHIP, and the Marketplace Plan. And we've had that grant for 10 years now, and we have navigators throughout the state, cover every parish, as well as the bayou parishes. So we provide that assistance. And so what is about to change is something called Medicaid Unwind. And so Medicaid Unwind is basically starting in March 2020 when the pandemic hit. The Center for Medicaid and Medicare Services, they lessened the requirements for Medicaid redetermination and eligibility. They didn't want anybody during the pandemic to lose their health insurance coverage.
Right. Because you might not be working.
That's right. You may have lost your job or something like that. So they lessened those. They gave states extra funding to be able to cover that. But Louisiana Medicaid and the Center for Medicaid and Medicare Services has stopped the continuous enrollment process, and that's going to be stopped, like you said, March 31st of this year. And so April 1st, the redetermination process is going to start over again. This had normally been done every year. So if you're used to having Medicaid, you had to renew your eligibility every year. But that has not been done in 3 years.
Right. So it's a lot of new people coming into the program.
There's a lot of new people.
This will be their first time.
Correct. And like, I don't know if you've mentioned yet that there's over 2 million in the state of Louisiana that now has Medicaid or LCHIP services.
Yeah.
And LCHIP means Louisiana Children's Health Insurance Program.
Right.
So there's over 2 million of those. So through this 12-month process, all of those accounts will be redetermined and checked for eligibility.
Right. So 2 million people, that's a lot of people on this, and it'll affect a lot of people. The majority of those people are probably going to make the redetermination, correct? But there's you're thinking 260 to between 400,000, 260,000, 400,000 are people that are not going to get the letter. So that's where it's going to come in. That's a big deal for any community, right, Doc? It's
huge. And I mean, just kind of speaking of how public health is our role in it. The Office of Public Health, especially here recently with COVID, kind of probably know us better for that role. COVID response, COVID vaccinations, our public health units, things like that. But it's really part of a larger umbrella. It's underneath the Louisiana Department of Health, or LDH. And part of that umbrella is Medicaid. And so as part of a team effort with the Navigators, with Medicaid, we're getting out there. It's really, this is a major goal, is to get this education out. We really don't want anybody to lose their coverage. And not responding to letters that they may receive to update their information, things like that. Even if you're eligible, you may lose that coverage. So we really need people to update their information and respond to those letters for requests for information.
Well, that's part of the deal. And we've had a big hurricane down here, right? We kind of, I don't want to say we're a transient community, but people have moved around a lot over the last couple of years. So you're talking about addresses, that kind of stuff, children moving around. I guess migrant children probably or in the CHIPS program, I would imagine, those kind of people, because we provide health care for anybody that comes in, right? So that is another thing too, right? If you're moving around a lot, then you don't know. So what could help? How can people get in touch? They can actually call you guys and say, hey, can you help me find the best recommendation for me if I didn't get that letter?
Yeah, and so the letters will go out. Let me tell you a little bit about the process of how the letters are going to go out. The first letters will go out in May 1st. But 2 million people is a lot to redetermine. So there's going to be a 12-month process. So 169,000 of the Medicaid accounts will be redetermined every month. So that means that about 169,000 will receive letters for that particular month. So that process is going to continue for a 12-month period. So some may receive a letter in May, some may receive a letter in June, some may receive a letter in September. And I think that's going to be very confusing for a lot of people because their neighbor's going to receive a letter and they may not. And they're going to go, oh no, did I lose my coverage? What's going on? But at the same time, with the transit community and with the hurricanes and a lot of moving, a lot of times Medicaid is not going to have their current account information.
Yeah.
So they're not going to get the letter. And if they don't get the letter, not all are going to get a renewal letter. Some are going to say automatically eligible because of the software that Medicaid uses. They take wages and federal income and they determine it by that. And so half of those 2 million are going to already be determined. But if they're not, then where we can step in is we can help them update that account. We can help them also check their eligibility. We can also have the one-on-one assistance. We can meet them locally where they are. We can meet them at a church, a library. We can do a virtual visit to make sure they are not losing that coverage. And if by the chance they are determined to not be eligible anymore, they get a denial letter, then what we can do is put them into a marketplace plan.
What can the health unit specifically do, Doc, that can help patients should they be denied or get one of these denial letters?
Well, kind of what we're doing through the Office of Public Health and the health units is multifold. It's not just in the health unit itself. We're trying to get out in the community, like you said, especially in our region with Hurricane Ida. Over the last couple of years, people have moved. So a lot of that information is not up to date, and it's vital that we have updated information for people, address, phone numbers, things like that. And so we're trying to go out and provide resources and education where it's needed. Of course, people can come to the health units and get those resources, but really we're utilizing other community organizations. We're having other public health events, and we'll be bringing all those resources out to the public. We are in the planning stages we want to go out to like Rebecca Village where some of the Hurricane Ida trailers are, where some of these people may not be receiving their mail because they've moved, they've been displaced. And so we want to go out there and really share these resources in education. Like I said, it is vital that Medicaid members update their mailing address and make sure. I really want to drive that point home. They really need to get their current mailing address and contact information out there. They're gonna, like I said, they're gonna be mailing out letters at different intervals, and when you get one of those letters, it's really important to read that letter and follow those instructions. So even if you're eligible, if you don't follow those instructions in the letter, you may lose coverage. And that's the last thing we want to happen, of course. So at the health units, we'll have papers we can fill out for them with updated information. We can help them log on into the computer, and we can update that information for them and submit things. We've got information we've got mymedicaid.la.gov. Patients can get on and update their information themselves. They can email mymedicaid@la.gov. They can call us at the health unit, 985-447-0916, and we can talk to them about some of this information and resources. They should have a Medicaid card. If they have their Medicaid card, they can look at the back of it. They should have a phone number. They can call that number, and they should be able to point them in the right direction and or update their information for them. And there's also a Medicaid customer service number. That's 1-888-342-6207 that they can call. If we have a good phone number for them, a good cell phone number that receives text messages. Medicaid also plans on sending out text message updates
Right.
and reminders for these services. Like I said, we're really trying to do everything we can so nobody falls through the cracks. We really don't want anybody to lose their Medicaid coverage that's eligible. And anybody that may have lost that eligibility criteria, we want them to be pointed towards the marketplace.
Where to go, right.
Where to go so they can get plugged in and don't lose coverage.
Yeah, we're talking about almost half the state, close to half the state that this is going to be affecting. But we in the media can kind of make sometimes like it's this cliff that everybody's going to fall off. And I think what you guys are saying is there is a lot of programs. It's not going to be the cliff if you do things the right way. So it's more important to know and have the information of how to qualify to be able to do that, right? We're not going to just kick people off and they're going to be out in the street. There's things there for them, right? There's services that you guys provide and the state provides.
Yeah, the services are there.
We just got to make sure everybody knows how to do it.
We're doing everything we can to get that message out to make sure that people know how to access those services.
And of course, the resources are there. For us, we don't think anyone in Louisiana should not have health care coverage.
right.
There are so many options available, but it's a lack of awareness sometimes. And it's also sometimes intimidating. So sometimes, it's sometimes complicated to apply or complicated to figure out the system, and you're overwhelmed by it. So that's why the great work the public health unit is doing is helping with that as well. And then our navigators are walking with people one-on-one. We provide information in a very logical, easy to understand way. Right. And we're able to provide upload any account information that they have. If they receive a denial letter, let's talk about the marketplace. Dr. Brooks talked about that. Mm-hmm. If they receive a denial letter from Medicaid, that they're no longer eligible because of increase of income, change of family, anything like that, they receive that, then they can be referred to a navigator who's going to help them apply for a marketplace. The marketplace, the federal marketplace, is a way that you can shop for quality health insurance. They do cover, they're required to cover the 10 essential benefits of other private plans. There are several options available. And I think, like you mentioned earlier, some of the plans are very low cost. Someone may have applied several years ago. It's been around for 10 years. They may apply several years and say, oh, I couldn't afford it. That's changed. Congress this fall passed an Inflation Reduction Act that lowered the premiums for the marketplace.
Right. Kind of complicated thing, but make it easy. It can be easy, and that's kind of what your job is to do that. So how does somebody go about actually going to get in contact with you guys? Let's go over that one more time. And what do your services provide?
So again, they can come into any health unit, any parish health unit, and we will connect them with those resources directly. We can help them update their information with Medicaid. We can make direct referrals to the Healthways Navigators program. And if they're not eligible for Medicaid for some reason, the navigators can help them through that marketplace, which can be pretty complicated sometimes. But resources are definitely there to help.
Right. And that's where y'all can help out, right? We talked about it. They can go in the marketplace. And we talked about the marketplace. That's the Affordable Care Act. Which is Obamacare, to make sure everybody understands what we're talking about. But because of the Inflation Act, they're also lowered some of the premiums, and it's affordable for those folks.
Yeah, it's much more affordable. Many people look and they said, oh, I applied about years ago when it first started, and it wasn't affordable to my family.
It didn't seem right.
It didn't seem like that. But they have changed that. So the premiums have been lowered, and that was done this fall by Congress to lower that. So, if you fall into a certain category, you could have a zero premium or, either a $10 a month premium. Right. Your premiums can be much lower. And again, most families are going to be eligible for a marketplace plan. And I think we mentioned that you may, if you're employed, and you may be able to afford your employer plan for yourself, but you can't afford the family plan. It's much, it's over your budget for that. Your family could be on a marketplace plan. So, and the marketplace they're actually called qualified health programs. So they cover all essentials that most insurance covers. They're required to cover that. And then it's just like others, you're going to shop through the best plan that's going to best meet your family's needs. And so that's where our navigators come into place. And so it's often complicated, like Dr. Brooks said. And so our navigators will help you walk step by step the process and help you upload the appropriate documents that you are going to need. And then they're going to be able to, assist you in choosing a plan that best meets your needs. And then you're going to actually have health insurance. So like I said, we're very fortunate in Louisiana that most everybody in Louisiana should be able to afford health insurance.
Right.
It may be a short period of time where you're waiting to be able to get into a plan, but most everybody in Louisiana should do that. And then through this Medicaid unwind process, like Dr. Brooks said, we want 100% of anybody that's on Medicaid to be able to continue to have health insurance coverage. But they get the information, they fill out the renewal letters, and if they're denied for eligibility, then they can get on a marketplace plan. But we want all of our residents to be able to have health insurance.
Yeah, I shouldn't ask a question I don't know the answer to, but like for immigrant families, people that came in here and worked, after the storm, those people can qualify for these programs or no?
There are some that can. It just depends on
Like if the
their
children
status.
go to school?
Their status. There is some criteria for their status or immigration status, so it just depends on what their status is. But it's definitely worth looking into and being able to talk to a navigator about and check to see if they're eligible. A lot of times they feel like they aren't, but they may be.
Right. They're just scared to do any kind of
Correct.
government program,
Correct,
even
correct.
school, so.
Correct. But they could be eligible. And their children definitely, if they are born in the United States, then they will be eligible.
Right. Okay. And so, Doc, there's a lot of different ways, and when you talk about Medicare, dual eligibles, people over 65, this is probably another way to help those people that maybe have changing needs when it comes to when they get over 65.
Yeah, absolutely. And if it's been a couple years and they've kind of lapsed with keeping things up to date, you take that opportunity to get things up to date and make sure that you're still eligible and you maintain those benefits.
Yeah, no, that's what we're talking about. I mean, you think this has been 3 years, so a lot of people's
Things
life
have
has changed over the last 3 years. So y'all can't do everybody, right? You can't do 2 million people, huh?
Well, there's I think like Dr. Brooks said, there's lots of services available. There's
Right.
lots of resources.
Right. But
Team
I'm
effort.
talking about for y'all to handle that need. There's a lot of people.
Well, it's going to be kind of, like you said, staggered over several months, sending out letters. Of course, the phone lines are always open. The health units are always open. So we do expect and plan for a surge, but we also plan for more of the marathon over the next year, kind of helping people. People aren't going to get dropped, instantly. So.
Right, and I think that's the big kind of takeaway. We're not, that's not a cliff. And again, when I first saw this coming, they were saying, oh, he's going to end the Emergency Act, which means Medicaid's going to change. I was like, oh man, that's going to be a lot of people, scrambling. But the point is, there's things there. It's going to be a soft landing, should be for anybody.
Yeah, and I think the big point is, and Dr. Brooks has said, is that make sure your Medicaid information is up to date, your contact information is up to date, and don't be fearful that maybe something changed in your family, that maybe, oh no, I'm not going to be able to have Medicaid coverage. There are other coverage available. You still can have health coverage for your family, and that will be through the marketplace. So I think, and it's just a matter of knowledge that there is going to be a renewal period. You are going to receive a letter, open that letter, respond to the letter, and contact the health units, contact us, that you can be able to be connected to the right resources and just know the resources available and not be fearful.
Well, Taffy, thank you, Doc. Appreciate it. Great information. We'll be right back with more Bite Time after this.